What happens once the surgical procedure is done, or the intervention, which is another way of calling a procedure, a medical procedure? What happens after that is done and now you go back to your life? Because if you've had a surgery of some sort, you know that sometimes there are things that are sticking out of you, what we call drainage catheters, or maybe there's a drainage bag that is sticking out of your body. And now you go back to, quote unquote, your life again, but life is not the way it used to be before. And now you have these things that you have to deal with that they're very uncomfortable, they're not intuitive to live with them. And it just feels like you've lost your freedom. And I've seen this over and over again. Some years back, one of my patients brought this to my attention, how this phase of life after having a medical procedure can be so challenging, and it feels like you've been completely left alone. So I started to think about this and talk to some colleagues of mine, and that led to the creation of what I ended up calling the Surgical Drainage Awareness Foundation. I'll say that again, the Surgical Drainage Awareness Foundation. And this is an initiative to educate people, to talk about what are the things that we can do during that phase of our lives where we might have just had a surgical procedure and now we feel completely alone, desolated, we don't know what to do. And unless there's something that goes wrong, which is not what we want, now we're just grabbing the phone to call our physician and go back to the hospital to see who can take care of us. Well, that's not a great situation to be in, and clearly something that we want to avoid. And that's what led to this foundation, which is ultimately geared towards educating the public, also creating materials to serve those people who are practitioners in the industry so that they can serve their respective patients with information that is super valuable for them to take care of patients once they've had the procedures.